anti-tuberculosis drugs are used to treat tuberculosis. They are divided into first-line drugs. These are the most effective medications which have a bactericidal effect, meaning they kill the tuberculosis bacillus and have the fewest side effects, and second-line drugs. Second-line drugs are used for people whose tuberculosis bacillus is resistant to first-line medications. This is what is called polyresistant tuberculosis, when there is resistance to one or two drugs, and multi-drug resistant tuberculosis when there is resistance to all first-line drugs. There is also extensively drug-resistant tuberculosis. This is a situation where the tuberculosis bacillus is resistant, meaning it does not respond to and is not killed by either first-line or second-line drugs. Such people are treated with individualized regimens, but fortunately their number is decreasing every year thanks to early detection and supervised treatment, which is used in our country. In 90% of cases, tuberculosis treatment is outpatient, meaning the patient can be treated while staying at home. The medications are in tablet form. None of our first-line drugs are administered parenterally. In other words, they are all tablets. A patient who is excreting tuberculosis mycobacteria in their sputum is only contagious for 2 to 3 weeks after starting treatment. In fact, they pose a risk before tuberculosis is diagnosed because they go about their life unaware that they are potentially infecting others. As soon as treatment begins, within 2 to 3 weeks, the tuberculosis mycobacteria lose their virulence, meaning they can no longer infect anyone, even if tuberculosis bacilli are still detected in the sputum. Therefore, if the patient is not excreting bacilli, they can receive medication at home from the very beginning under the supervision of a family doctor. If a patient is excreting bacilli, then for up to a month, usually for 2 to 3 weeks, they are hospitalized in a tuberculosis facility where they begin therapy and are then discharged for outpatient treatment. The first-line drugs are isoniazid, rifampicin, pyrazinamide, and ethambutol. They are prescribed in dosages according to the patient's body weight. That's it. And the patient takes them according to the regimen recommended by the phthisiatrician. There are many more second-line drugs, and the regimen is selected individually, depending on the specific sensitivity of the microbe in each patient. Based on the results of the bacteriological examination, we determine which drugs the bacillus is sensitive to, and it is precisely these drugs in specific combinations that are prescribed to the patient. The treatment of drug-sensitive tuberculosis lasts 6 months, 2 months of the intensive phase and 4 months of the continuation phase. The treatment of drug-resistant tuberculosis takes from 12 to 20 months. Tuberculosis is completely curable. The only thing you need to know and understand is that the treatment must be continuous and regular. In other words, the patient must take the medications from the beginning of the prescription until the very end. After completing the treatment, the patient is healthy, meaning there are no viable bacteria left in their body, and the tuberculosis service monitors them for 3 years. That is, the patient goes for follow-up examinations. After that, they live a normal life. So this is not a chronic disease. It's not an illness that turns into a slow, lingering form or just gets suppressed, as people often say. In other words, tuberculosis is completely curable. It is important to remember that under no circumstances should treatment be interrupted, because if the patient stops treatment, the microbe develops resistance to the drugs that were used, and we end up with a resistant, multi-drug resistant, or even extensively drug-resistant form. And of course, any subsequent course of treatment will be longer and much less effective.